So one of the things that I think we get caught up on when we think about this concept of patient suffering is that there's more people in healthcare that involve suffering than just patients. You have caregiver suffering, you have family suffering. Certainly you can take it down to specific caregivers, nurses, and physicians. I remember one time, it was December 22nd, and I had just gotten home from shopping, and I went to bed, and my phone rings. And it's a colleague of mine on call at the hospital calling to tell me that a patient that I was involved in taking care of had just arrested and died in the hospital. And so, I dragged myself out of bed, and I got in my car and I drove to the hospital. And I remember it very vividly for a lot of reasons, but it was also the first and worst snowstorm of the season. And I got up to the hospital floor, and if you've been to the site of an arrest before in the hospital, you know what it looks like. It's like a mini war zone. The crash cart's open, there's debris all over the floor. The nurses are fatigued and exhausted. They are essentially the Marines who storm the beach at the first sign of an emergency, and they just run this code. There's physicians there. You see the family who is talking to somebody from mortuary services, trying to make arrangements for their loved one when 6 or 8 hours earlier that same family had been told that their loved one was fine. And you just take in the scene. It's very surreal because so many people are emotionally drained, and to think that that doesn't have an impact on them is just ignoring the impact that what we do has on a lot of people in healthcare. But I think what makes it particularly interesting and surreal for someone like me was, when I had arrived at that scene, the person that had arrested and died was my father. And it puts you on the other side of something that, for so long we were only on one side of. As physicians and nurses, many of us are fortunate that we've never been ill, we've never had a loved one seriously ill, and you glide through life from this perspective that everything is terrific. But when you have an event like that, and you're in medicine and you're forced suddenly to be on the other side, you recognize what it's like for patients and what it's like for the people that are caring for patients. And so as we think about our collective responsibility for fine-tuning our cultures, making sure that the people that work in healthcare are aligned around the patient, thinking about this concept of how do we drive towards safer, higher quality care in an environment where people feel cared for, it's really incumbent upon us to recognize that it's cultural, and we have to work hard to think about how we put ourselves in the patient's perspective and have empathy and deliver compassion, because the other side is very different, and many of us as caregivers don't really recognize it until we've experienced it.